We want to get started just with your background, just so we can figure out like the work you do and everything, and then we'll get into the whole thing with your daughter and kind of go from there.
So I'm Brandi. I actually, let's see, I'm an ICU nurse practitioner now. When I started sharing in 2020, I was a bedside RN. I did both ICU and ER, and I did bedside nursing for 10 years. And so I had a lot of experience, especially in the ED environment for 5 years, interacting with people who are struggling with substance use disorder and mental illness, everything, you see it all. But that job, you get burnout, you really do. And so I did that, and then at the time when I was working in ER, I was working on becoming a nurse practitioner, and I was living out west in Coeur d'Alene, Idaho. And then we ultimately decided to come back to Florida, where I was born and raised, and that's kind of where we've been since. So as I said earlier, I'm an ICU nurse practitioner, and that's really it as far as my background. I mean, I guess you say I'm a mom of four. I'm married. I've been with my husband. We've been together going on 16 years. I'm a grandmother, a Gigi, I go by. I call it gangsta grandma. That's
Hey, I love that.
Yep.
And I have 3 dogs and now just 1 cat. So.
When did all of this start where you actually decided making content first? Like, was it just because the RN side of things, or was it because of your daughter?
So actually, I got on here like many did with COVID starting. I had never really, I don't even know how I heard about the app at first. I think maybe my other daughter was talking about it. And then I got on, and of course, it was a lot of dancing and all that. And you guys know, like I dance in videos too. And
I love it.
Originally, I was trying to make funny nursing content that just as kind of an outlet, and doing some of the dance videos and trends that were going on. How I started talking about our story was my daughter, it was, I think, a little bit before I had mentioned her struggling with addiction. I had made 1 or 2 little videos about it. But she had gotten sober. She had gone to treatment the first time, was sober. Well, so we thought was sober through the summer. And then she relapsed, and how I found out was she wrecked my car, one of our cars. And she took off from the scene, and I knew
Right.
she had relapsed, because that was just not her behavior otherwise. And so at that point, I made a video. I pissed a lot of people off with that video, because I just vented. And that's something I've continued to do, is just kind of make videos in the moment. And like I said, I think that's why it works. Yep. Is I literally, there was no filter. And I mean, I wasn't a complete asshole, but it was, but looking back at that, it was harsh. I mean, I think at one point I said, addicts, you're killing us. You're killing your children. That's literally what I said in that video, because I was heartbroken. Right. And in shock, and you can even tell it in that video, how it's just word vomit kind of coming out.
You were hurt. Yeah, you were hurt.
I was hurt, and I realized I was very naive before and thought this was a one and done, and she was doing so well. And so at that point I made that video, and then it kind of went from there. I got a lot of hate, but then I had a lot of people in recovery trying to give me advice and kind of be there for me. And that's kind of when I started realizing, wow, can find a sense of community here.
Now, I followed you from the beginning, and I saw that shift in you. Mm-hmm. What was the point that made you have that shift? What shifted your mindset about medicated assisted treatment?
Gosh, it was actually Because yeah, when I first started speaking, I think one of the next videos was me talking
Right.
about medicaid assisted treatment and how I didn't support it. I thought you were trading one drug for another, and I got a lot of feedback because I was genuinely curious. Because I don't claim to know everything,
Now,
and
you weren't taught any of that in school, right? You
no,
went to
yeah.
schooling, you're a nurse practitioner. They don't really discuss those things.
No, they
No.
don't. That is something they don't. You get additional education through hospitals, and now they're doing more like education regarding addiction now, like through the hospital setting. That's a requirement but it wasn't taught specifically in school. You learn about each individual drug, but when I was in nursing school, you didn't learn about Suboxone. You didn't learn about methadone even. You didn't learn about those. And even MP school, that wasn't a focus. You go psych, like they have different areas. So if you go psych MP, you're going to learn more about all of those. Like in my setting with acute, we should have some education on it, but it's not the focus. And let's see, what was I answering before? I forgot.
How you shifted your
Oh my
mindset.
God, okay, thank you.
You're
How
good.
I shifted my mindset. So I had made that video and I started getting a lot of feedback, and I read. I read books, I read studies, I do all that. And so at that point, actually, Nicole, Recovery Nicole, she's changed her name so many times. I don't know. She had constantly kind of messaging me privately about MAT, and I started watching videos. When you're watching your For You page and I hear people sharing their MAT stories, I listen. I listened, and so when she finally wanted to go to treatment again, it was in December of 2020. I actually was trying to see if I could get her into a facility that had MAT, but COVID was in its prime. I was out west. Everywhere was on lockdowns, like quarantine, because they wouldn't allow, you had to wait for a test, or they weren't going to have a bed for 2 weeks because of quarantine. And so I was desperate. I needed to get her in somewhere. I found a place in Montana that could take her right away, but they didn't offer that. They were a dual diagnosis, but they didn't offer that. And so she at that time also was kind of not wanting to try it. She wasn't considering it, because I think a lot of that had to come from me. And I've always talked to my kids, and she hears me talk about these things. So I think that stigmatizing view came from me. And do you have a question?
Was there anything else you explored besides Matt? Because I mean, there's like NAD plus. You can do, I don't know. There are a whole bunch of new things now, like the neural implants and all that stuff. Was there anything else that caught your eye, or was it just the Matt that you were kind of coming around to?
No, I honestly, I didn't start even hearing about ketamine being used in like this capacity NAD until really recently.
Right.
I was not aware that all of that was going on, that those were options. They weren't things that we had necessarily where we were out west. So no, and at the time, I think I was just so consumed with raising my grandson, because we got him, school and working full time, and trying to not have a nervous breakdown. And I didn't start really studying in depth until a little later on. Like it did. That's when I really started exploring.
You were just trying to get her in somewhere as quick as possible because you thought it was the safest option.
Yep. And so it was like after that, she had left and she was on the streets of Montana. And then when we were moving to Florida, she reached out and she wanted to go to treatment. And so my mom picked her up. She flew up, drove one of the cars to Montana, picked her up, and hauled ass across the country to get her into treatment. Now,
Wow.
that place had MAT, and that was the first time she was agreeable to trying it.
And how was her experience the first time that she got put on it? Did she stabilize her dose, or?
what I know now, it's kind of what I wish I could go back and see exactly what doses they had her at when they started it, because I truly believe people are being underdosed now.
I agree with that. That's why I actually asked that question, because a lot of times people don't get to the stable dose, to the therapeutic level that they need to be at.
Now, what we know now, because we learned that she has an anaphylactic allergy to Narcan, which is, crazy. But she could tolerate the lower doses of the Suboxone. And that's why, because she had never had a reaction. But she did mention, and I don't know what dose she was at, she had to get an EpiPen done at that said treatment facility. And they thought it was a shellfish allergy. And I'm like, she's never been allergic to shellfish. And looking back, she goes, Mom, that was when I first started Suboxone.
Wow.
And so that might have been a higher dose she was on, but they thought it was shellfish. And because she just ate a whole plate of shrimp last night, it's not shellfish. It was definitely like the naloxone. That's all we figured out, is it had to be the naloxone in it.
And I've heard of that before. I've heard of people having that.
Yeah. And so she was always the 8 milligram strips. Like when she would come home, she was only taking half a day. Like for somebody that's a hardcore, like fentanyl user, I mean, knowing what I know now, that's nowhere near enough.
You're absolutely correct.
And so, but yeah, that was kind of the issue. She did well though on it. The piece of that story, she'll have to tell at some point as to why she relapsed when she was on Suboxone was actually not due to the Suboxone. She had actually weaned herself off, but that's a story she wants to tell down the road. So, but it was not, her relapsing actually had nothing to do with the Suboxone not working.
Was there a plan in place at all whenever she got on the subs? Was it like, I'm going to be on this for X amount of months and then start weaning off myself? Or was it one of those things you went in thinking she would be on it forever?
I went in thinking, because I saw that I got my daughter back in it.
Right.
I didn't know what to expect. And when I saw that I got my daughter back in it, it didn't matter to me. Like her, and I think for her, because of the stigmatizing views and, going to meetings, because all these programs are meetings and stuff, is that she felt like it was bad of her to be on these meds. And I've had to talk to her quite a bit that, like, if you eventually want to get off, obviously I'm going to support you, but don't ever feel like you have to get off because of what someone else thinks.
Right. But the treatment center didn't ever actually discuss a plan with you? Because that was how it was with me. Whenever they started me on subs, they didn't discuss anything. They're just like, you're going to take these and everything's going to be good.
Well, so a perfect example, talking about that, the treatment facility she went to and got discharged from, they didn't even give us a script for Suboxone. What? So, yeah. And I'm like, so I called and I raised hell, and I'm not gonna lie, I pulled my social media card. I totally did. Go. And I did, and I said, I am going to bring this up. Like, if you do not give me a script, I have no problem. I will find her a provider, but I do not want my daughter going through a withdrawal, because you're discharging her with no even provider in place.
That's absolutely unnecessary and wrong to do. You don't get somebody on a medication to leave it up in the air.
Yeah. So I was very pissed. They did do it. They had the person call it in. So she did get a month's supply worth until we could get her with a provider. But yeah, no, that, I feel like honestly, treatment never educated me on anything. And I have no idea. There never seemed to be really, there's all this thing is discharge planning. That has really been a joke, I feel like, at almost every place that she's been to. So.
Yeah, no, I agree with that completely. There's never a plan. I think at mine, they kind of led me towards some doctors I could go to. And I think they gave me like 5 days and was like, you should be able to get somewhere in 5 days. And I was like, cool. But it took like a week and a half. It sucked.
Yeah.
When I'm going back a little bit, but when you found out about Brooke's addiction, what did you think? Like, what did you do in the first place? Just because you were kind of in the field, so you knew something about it at least.
Gosh, when I found out about it, I just remember like I felt like my heart fell into my stomach, and just I was kind of in shock. Like I knew my daughter had experimented with drugs, recreationally and stuff, and she had struggled, but she had my grandson, and she was sober throughout her entire pregnancy. I mean, she was super healthy. And so, but we were living across the country. She was in Florida and we were out west. And so we were far, and I was flying down every 3 months. And I was worried she was going to suffer from postpartum depression because she had.
That's what I was going to ask you. You said about a dual diagnosis. Did she have issues growing up with mental health prior?
Depression more than anything.
Right. Makes sense.
Yep, she did. And so, and she had been very stabilized on medications from that. And she had been in therapy for years. We really were proactive while we could be when she was a minor. But when she wanted to get off of all of her meds when she was pregnant because she didn't want to harm the baby and risk that. And so I told her, though, I said, you have to get back on your antidepressant because you're going to be prone to probably getting postpartum.
That was the downfall right there, her not getting back on the mental health meds. Because after you have a baby, your hormones are so up and down. I've experienced that myself. And it's like you feel like your body's out of control, your mind's out of control.
Yeah. And then, I'm across the country. My mom is here. My mom is helping her. But me, I can't really be there. I'm trying to come down every 3 months. And then she was with somebody who treated her horribly on top of it, which definitely exacerbated the postpartum depression. And so ultimately, that's her story to tell as to when she did that. But
now, how young was your grandson when you took custody of him?
I actually got him his first birthday, like almost exactly. But I found out, so that was in March. I got him. It was December, the 2 days after Christmas. I found out that she was using IV fentanyl. It was 2 days after Christmas, and I thought it was a mental breakdown. Like that's what I said. I'm like that.
Yeah.
And then she came clean to my mom, and my mom told me, and her and her boyfriend were not happy that I found out because my first concern was my grandson. Like it's my daughter, but he is a baby, and I'm across the country, and I'm worried about his well-being.
Right.
And so it was at that point, I was definitely not the most supportive probably to her. And we had a very strained relationship either way at that time, very toxic, a lot of animosity. And, but of course I didn't help it when I said, but I meant it with love, but I said, listen, you're going to have to give me miles for, and you guys go to treatment, and that was it. I wasn't saying I wanted to have him forever because that was not the plan, but just so they could go to treatment and work on themselves. And I got a big F you. So
now, how hard was that for your husband? Because that's got to be something that's probably hard for a relationship as well. Like now you got a baby.
My husband, it was very hard. My
sure.
husband, because you have to understand, I was in MP school wrapping up. I was doing clinicals, which was like being full-time in. Then I had to start, I was going to go part-time working, but now we have to pay for daycare for 2 kids. And that just for our grandson, that was over $1,000 a month. So I had to keep working full-time. And so now I'm home, but when I am home, I'm studying. And my husband, he took on that. Like, I tell you what, he's an amazing man because I could not have finished school. I could not have done any of it without him. it's not possible. But no, it was hard. It was hard. We made it work. That's what you do for your
Yeah,
family.
you figure it out. You just figure it out. You roll with the punches and you keep on moving forward.
Yeah. And so, but yeah, no, I could not have finished school if it wasn't for him.
How was he with Brooke whenever everything was going on? Because like I've got stepkids, and whenever it comes to they do something wrong or something serious is going on, there's kind of a fine line to walk sometimes just because of the other parent. Was he able to like jump in there and be right by your side, or was there a little bit of distance at first?
So our marriage we were close to getting divorced a couple of times prior to the addiction. And I don't know how, everyone's marriage is different. My husband really stepped up, and I am not a super affectionate person. It's just not how I am. And he got even less of that, obviously, when this all happened, because now I have more people needing me, and I'm literally drowning inside, like with heartbreak and anxiety that my daughter's going to die.
Right.
And my husband, though, he never demanded anything from me during that time. Like he didn't, I thought he would. He gave me the space I needed. He knew I'm trying to be there for everyone.
Right.
And because the kids, I'm trying to be there for each kid. And then, like I said, I'm struggling. But our relationship somehow became stronger. Like, honestly, our marriage really healed.
You can't pour from an empty cup. Was there anything that you did during that time for self-care for yourself to like try to take a step back from all that was going on?
TikTok.
There you go. I love that. TikTok became a therapeutic outlet for you. I love that.
Yeah, and a lot of people don't get that. I'll frequently, at one point I blocked the word Al-Anon from my keywords, because I was so sick of people saying, go to Al-Anon, go to Al-Anon. I'm like, I've been to Al-Anon, it's not for me. I do tell people though, when they message me, you should try it. It might be something for you. But TikTok for me was, to me, the most healing outlet that I had. And I found a sense of community.
I love that.
Mm-hmm.
How did you shift more into the harm reduction mindset?
I would say that really started, there was a slow shift over the years, from the beginning to going through. Harm reduction, though, I really struggled with not using the word addict. And I had a lot of people come at me for that. People in the harm reduction community at one point were trying to cancel me. And so I think it was when she left treatment in Baltimore, January, almost a year ago.
A year ago, I remember that.
And I realized how corrupt the system can be. And I think that, I kind of realized, I'm like, I just feel like everything that's being taught is wrong. Like this, clearly it's not working when you look at numbers and then just thousands of people messaging me over the years. And I listen and I try to respond, and I take tolls in my head of what most people say work for them and whatnot. And I think hearing all those stories, and it finally, I started really listening, and then, I shaved my head. I call it my Britney Spears moment. And
that was therapeutic for you though, wasn't it?
It was I really believe like my healing journey truly began when I shaved my head. Like it was, the most amazing thing, and I have no regrets doing it. But I think then also really harm reduction, I really started talking about that, and was when Angel passed, the real Melissa's daughter. I have a lot of respect for Melissa. Melissa, those who don't know, she's a mom on here who
I love Melissa. I love her.
And when Angel passed, it just really, I'm like, we're not promised tomorrow.
You know what it is? You were empathetic at that point, and you were like, this could be me. I feel those emotions, and your mindset probably did a 360 at that point.
It did. And I'm like, cause and Melissa, I messaged Melissa. I mean, we text and stuff.
I know
and,
you're friends.
Yeah. And I told her, and she knows details about things that, obviously we don't share. Even she said, we don't share every detail
Right.
on here. So she knows more of the story, and she would give me honest feedback, and she's a big reason why I decided to reach out and meet my daughter where she is. And another person
I love that.
I want to say is it Allie with Savage Sisters? Is that she had made a video prior to Angel passing about her mom meeting her for lunch and active drug use. And she had shared that. And that video, like, I messaged her, I cried watching that video. And I think maybe Angel had passed. It was all right around the same time. And I've messaged her and told her that video that was when I feel like it also really changed for me, was watching that. And I decided, I'm going to do this. I'm going to reach out. And
your mindset shifted, and you started being more vocal on TikTok at that point about harm reduction.
Yeah.
Did you get good feedback at first, or were people like, yo, what's going on, Brandi? Like, something changed?
I feel like I got pretty good feedback. I really do. I think a lot of people realize, in the community, what we're doing isn't working, and none of us really know the answer. Like,
do you bring this to your job, the harm reduction? Like, do you try to teach other nurses and doctors, like, we need to be a little bit more?
I did. I was asked to do a presentation through the system that I work for, and I decided to do it on addiction, and doing it about basically treating withdrawal with opioid use disorder in the hospital setting. That's what I did, because it's undertreated. And so one of the big part that I put in there was about harm reduction and breaking it down and what it is, and going over why we utilize needle exchanges, why there are places that are having safe sites, for usage, and how other countries have been doing this for years. The U.S. is just very behind in it. So I do, I also try, being overbearing never works for anybody. You never want to force your views on people. And so if the conversation comes up in my job, I then share a piece of my story, but I don't go around being like, hey, I've lived this, you should be doing this. But if we have a patient scenario that comes up, I will make recommendations. And
so you use compassionate care in the hospital. Like, what do you do if, say, somebody comes in? I've done it before myself. I was withdrawing off of methadone before, and I literally had an ER doctor write me a month's worth of methadone tablets before.
Like, and were you wanting to get off of methadone? Is that what you were trying to do? Or
I was wanting to continue it. I didn't have my medication at the time. Like, I ran out of it.
Oh,
yeah.
But he still did that. And that I will always remember the fact that he did that for me, because honestly, I would have went to desperate measures and probably got locked up if he didn't do that.
I think there's a lot of people that have empathy and compassion. We all usually go into the field with that. You do lose it. I mean, this job is hard. Nobody's worked in healthcare. Right. You get treated like garbage many times. And you get burnt out. And when you get burnt out, it's time to go somewhere else, or give yourself a break. And find it again. But yeah, I think that there are also a lot of people who work in healthcare that have stigmatized views, and I have witnessed that. And I have a mouth on me, and I call people out on it, especially if it's someone I feel like I have that relationship with. I do, because it really upsets me if somebody's being undertreated, and like as a advanced practice provider, which is what I am, we have attendees who we manage our own patients, but we have attendees over us, and I have gone over the APP I work with to the attendee and asked them to treat it appropriately. I
love that.
wasn't being treated. And, it all depends on the attendee and whatnot. But, it's just a lack of education. Like, and it really is. I didn't know any of what I know. Like, you don't know. And you don't realize even how corrupt the system can be at times.
How frustrated were you whenever you first started doing all that, like research into Mad and everything, and then you got on TikTok, you started learning more sides of it, and then you started learning the harm reduction side? I remember I was so frustrated with the amount of misinformation online, because like the first 1,000 things you Google are all bullcrap, and then you can find the real stuff. So it was that super frustrating, especially being in the medical field.
So, in all honesty, when it comes to me, I don't Google most of the time because I have access to databases through my work. So I bypass all that BS. But it is. So one place I will say, if people are going to look up stuff, you need to go into Google Scholar. That filters out, because you're going to get articles and studies. That doesn't mean they're all accurate or decent studies, but it is actual data, and it's not just websites. Because anybody can create a website and spew false stuff. So,
How did you start to see this? Like, I noticed with Brooke this past time, I've noticed a shift. Like, I could almost tell that you were right there. Like, when you started making videos, it was apparent that pretty soon you were going to make a video saying that she was in recovery. I knew it.
Yeah. I think really Thanksgiving. I really think because like I would never allow her to be present for holidays and active use. And this was always like a mutual agreement her and I had about like her son, because she didn't want him to see her and whatnot. But once again, I think me feeling like it's okay, we're going to do everything we can to protect him, and we want him to have these memories with you. If God forbid something happened. She was never like, no. She was excited, and she has said, that she was shocked. And she even said when she came for Thanksgiving, she talks about how she was in awe of me because I had changed so much.
Wow, that's beautiful. That is so beautiful.
Yeah.
And when I saw those pictures, Brandi, oh my God, it made my heart so happy. Just the fact that you have those memories. It's all about making memories. It's not about being like, oh, you're doing this and I don't, like, you surrendered. You completely surrendered, and that's beautiful.
Yeah, no, and I mean, let's all face it, how stressful are family pictures? They're super stressful.
Oh my God, I can't even handle family pictures. It's too much mentally.
Yeah, no, it's stressful. You're fighting with kids, and then you all have to fake this smile. And then the youngest usually don't, because they're pissed off at that point.
Yeah, I get it.
And so I found this photographer who was able to come, because we did our Thanksgiving a few days before, because I worked Thanksgiving. And he was able to come on short notice, and we finished all those family pictures within 30 minutes, and we laughed. It was just, I just went into it stress-free. It is what it is, and have fun. And the smiles everyone has are real.
We're
smiles.
Genuine.
They're
yes.
real. And I mean, that was the easiest photo thing that I think we've ever done as a family. And they turned out so great.
How hard was it for the rest of your children to be like, okay, were they nervous? Did you have a prior conversation with them?
Yeah. So when, it's weird. It was all of a sudden. I was driving on my way to work. It was like 4 a.m, because that's when I go to work and I drive. I was overwhelmed with this uncontrollable feeling, kind of like when I shaved my head. It was just an overwhelming feeling to invite my daughter to Thanksgiving. I had not put thought into this, and I'm like crying. And then I messaged my mom first, and I said, hey, I'm wanting to do this. What do you think? And she's like, I think we should do it. And then I sat with each child alone and had the conversation with them, except for my grandson. We knew how he'd want to be, but we didn't want him to know until she was here.
Just in case she didn't come, not to let a child down.
Yes, I didn't want to let him down. But my 7-year-old, I spoke to him about it. And of course he was like, yay, Brooke. He was like, he loves her, and he knows that she struggles with addiction. How much he understands of that, I don't know, but we're very open for his age level. But yeah, each kid, her sister, who's 18, she was, she was agreeable. She was like, yeah, no, I think we should do it. But I think a lot of it, and then my 13-year-old son, he was okay with it. He was a little more quiet about it, but he said he was fine with it. I didn't want to do it without the kids all being on board, because it's not just about me. It's, this impacts everyone. And we had never done it before with her in active use. So you don't know what to expect. But I truly believed in my heart, because of how far we had come. And even my daughter, we were talking on a regular basis with her in active use. I knew that she would be on her best behavior.
Because prior you started meeting her for like coffee and lunch, correct?
Yep. And I started doing that prior, just me. I would open it up to the older kids if they wanted to come. They weren't ready yet. And I think everybody was nervous, not knowing what to expect that day. But everyone even said, they're like, wow, that's by far, I think, the best holiday we've ever had. Because when you go through this, you really learn to appreciate the moments you have with your family. And whereas we take time for granted, whereas at that day, I just took it all in.
How much, whenever you ended up having all those times where she went to detox and everything, I'm sure it was refreshing whenever she said, hey, I want to go. But then every time a relapse happened or you noticed something didn't work, how were those up and downs for you?
Oh, those are horrible.
Yeah.
And I've realized why they were so horrible. I've talked a lot about waiting on the ball to drop, because she is sober, she's trying, but then you see old behaviors creep in. But, that doesn't necessarily mean they're going to relapse, right? There should be a way to kind of approach those. But I would have so much anxiety. I honestly had less anxiety when she was in active use. I had way more anxiety when she was sober, and I think a lot of that stems from, I knew when she relapsed, I was going to cut her off. I was going to have to, ask her to leave. And, at that time, that's how I viewed it. She was going to go live on the streets, not know what was going to happen to her. And whereas now, where I am is, I don't ever plan on cutting my daughter off. I'm just at a different point, and I truly feel free with that.
I can't imagine all that time you bringing this heaviness to work with you, like having to sit and work and go through these overnight shifts, feeling like your whole world's crumbling.
Mm-hmm. I don't cope in the healthiest ways, work is a way I cope. So I am able to more or less shut that off and do my job. And sometimes work is an escape from my.
That makes sense.
And, and that's how some people cope. And I am very much one of those people now. But I will, if I have a patient that the story hits close to home, there are times where I walk out and I have tears running down my face, because it just hits you. You try not, but it does. It impacts you. So.
Right. It's got to be hard. Like if you see somebody come in with an overdose or something, and you have to work on them, and mentally you're thinking other thoughts in your head.
Yeah, I mean, one of the hardest, and I've made some videos talking about this. When I get them in the ICU, usually they have a severe anoxic injury. They're going to be brain dead, and they're going to spend the rest of their life in a nursing home if the family chooses to keep them alive. And that's usually when we get them, and those are heartbreaking. And because you look at them and they look like they're healthy, like they're just sitting. That's how they look. And it's, and so those are very heartbreaking, because when you're non-medical and you don't work in that environment, it's really hard to accept that they're not ever going to be back to their baseline functioning level.
Right.
Have you guys ever gone to therapy? Like, do you do therapy, and have you guys ever gone together?
We haven't gone to therapy together. And it's something that I think we need to do. Like, I think there needs to be little sprinkles. Like, I think my daughters need to go to therapy. They need to work some of their shit. And then I probably need to go to therapy with both daughters also. And, The boys so far seem to be okay. Like my husband and I, we did therapy through our marriage. We haven't done therapy since. As a family, though, would be good, but everything for the most part's going good. For me, one of the things I did after January last year was I found a trauma therapist, and I was with her, I think it was 3 or 4 months, and that really helped me a lot, and just kind of working through some stuff. And it wasn't as much about her addiction as much as it was my past marriage, my ex-husband, and the abuse.
Was it EMDR therapy? Was it
No,
a specific therapy?
yeah, it was NARM therapy, and I never remember. Heather will be in here. She'll look it up because she always says what it is. I can't remember what it stands for. And it's supposed to be therapy also that can take you back. I don't quite understand how, for people who had childhood trauma before the age of 5. That is usually when that is recommended, that type of therapy. And so I loved my therapist, and she was great. But I don't do therapy now. I am interested in doing EMDR though, just because Brooke always recommended it and said
I just started. So
it.
I only just got into like the beginning. We're going to dig into it, like meeting a therapist.
Neuroaffective relational mode.
How did you decide not to go with the treatment center route this time? Was it your decision? Was it Brooke's decision? Was it based off your past experience?
It wasn't my decision. Like I told her if she wanted to go to treatment, we would figure it out. I really tried not to put my 2 cents into it. I did tell her I would have to do a lot of research because I don't even know where I would send her. Like
right.
I genuinely don't trust any place, and I don't know where I would send her. But she really, it's always been, you had to go to treatment. That was all. It was never an option. You had to go to treatment. I'd usually get her in detox within the day, and she'd have to start this whole cycle of going to treatment. I told her that we didn't have to do it that way this time. That was one of the things when we talked even after Thanksgiving, because she had kind of hinted about thinking of wanting to get sober. And I would use that as an opportunity to tell her, I'll be like, well, MAT worked for you. We can try that and try therapy. Because I really believe now in what I know, the number one thing is them wanting to be sober and be
right.
And it's
can't force it.
No, you can't force it. And so that was, she wanted to do that. And then I didn't get a heads up as usual. I was on night shift, and then she woke me up because I have certain numbers that can come through when I sleep and during the day. And she woke me up at 11. And it's like, oh, hey, I'm at the gas station.
I'm sure you ran there. I'm sure you were there in record time.
I did. And, but yeah, and so she came home and we started that. Yeah.
Since you guys had so many issues with rehab facilities and everything, what made you in the end keep on going? Because I know you've gone to bat against a lot of them just because of how much they failed. Was it that last time you just decided this is crap and I'm never doing it again, or?
So we had not the best experiences at a few of the places, but really the last one, and then the interventionist and me, and it kind of all when that happened, I realized then, I was like, there is this isn't just body brokering that you hear about, because I had just started hearing about body brokering, and that is, you can look that up and it's easily defined. I'm like, wow, there is just a lot of shady shit going on here.
The fact that they didn't give her phone literally blew my mind. I couldn't get over that.
Yes, and that's a very common thing at treatment facilities.
That's horrible.
We didn't have phones. We didn't have phones the entire time. We were allowed to make calls every Friday or something.
They didn't give her phone when she left the facility. That's the issue.
That's right.
I do not. That is a safety issue, especially for a woman being in a foreign place that she doesn't even know.
Yeah, she was in Baltimore, Maryland. We're in Florida, and it's winter, and she knows nobody. She has no money. They gave her ID, but they wouldn't give her phone.
Makes
And
no sense.
but yeah, and then they were trying to use me as the excuse for why they didn't give the phone. Like they wanted my permission. I'm like, you guys never asked my permission on shit the entire time. You literally just cut me off from her. Like,
Yeah, I remember there was a blackout period, correct?
yeah,
Like a
yeah.
2-week blackout. How long
No.
did she last there?
So the blackout, all right, so she had been, she went to detox, which ended up being a month long, and then they transferred her to another facility locally to do this trauma therapy. So she had gotten like 2 months. She was 2 months sober when she went. So she wasn't like newly fresh, like within a couple of weeks. She had already been sober for 2 months on Suboxone. And so we found the long-term because we thought she needed long-term because she had never tried it before. And they took her. Well, we were told she wasn't happy about it, but I'm like, it'll go by fast. A blackout.
Right.
30, they said 45 days max. She was not happy about it, but I'm like, it'll fly by, it'll be okay, and then we'll be able to talk. Well, no, that was a lie. She was there for over 90 days, and I still had not been allowed to talk to her. Like, and then it's because I couldn't even write her letters. Like it was supposed to be, we could write back and forth. Like literally communication was completely cut off. And I was really upset. Like at one point I was threatening them. I'm like, I'm gonna fucking have somebody come and do a well check. I'm like, well, this isn't normal. And I would tell them, and it was like the sky was falling every time I would talk to this therapist that she's gonna leave. And I'm like, then why are you weaning her off her Suboxone?
Right. That makes no sense.
And
very manipulative. Very manipulative.
Yeah. She even told me when we were looking for facilities at that time, she's like, the number one criteria was she wanted to stay on her Suboxone. And that was the thing. And then I'm hearing from this therapist how immediately like they're weaning her. I'm like, we're going into her trigger season. She has relapsed multiple times around Christmas, yet they're forcing her to wean off.
Why would they wean somebody that just started MAP, that did not get their feet on the ground yet to rebuild their life? Makes completely no sense.
Apparently, the physician, the psychiatrist who works for that facility, basically said, you're not going to be allowed to stay on this after she got there, after we were lied to, and that, they're abstinence-based, even though their website says they're MAP friendly.
My God, that's horrible.
Yeah.
So they didn't give her phone. She leaves and you're freaking out. I remember that video that you made where you're like reaching out to see if anybody was in that area or could locate Brooke for you.
Yeah, I waited I waited about 3 days before I officially filed a missing persons report. I knew that she could be resourceful on, that she had lived on the streets before, but I'm like, this is Baltimore, and I was scared. Like I was going to lose her. And
fresh place.
And because she had not been allowed to have a phone at all through that whole time, knowing my daughter, I knew the first thing she would do would be log into her social media. Well, she had not over 3 days. And I'm like, we can't ping her phone. We have no way to find her. She has no way to reach out to us. And so finally I filed a missing persons report. That facility was no help whatsoever. All they wanted to do when she's missing was, I was being encouraged by the facility and the interventionist to go meet with the owners. And I'm like, my daughter is missing. Meeting with you and hearing your bullshit excuses is not my priority.
Right.
And I never did. And we never got her belongings back.
What do you think would actually help whenever it comes to reforming this whole rehab system? Because the way it's set up now is complete garbage, and I feel like it's going nowhere. And since you've had so many experiences with so many different centers, was there some things obviously you liked and then other things that were just complete bullshit like that? Or
All of them, I agree that treatment facilities should be individualized. Like you're not, everyone is different. And so I think that one big thing I think is an issue, and I don't know how it would ever work because money makes the world go round, is he coming back? Okay.
Yep.
I doing therapy, if they get that, and this is at a decent facility, getting therapy one-on-one once a week is not enough. I mean, like,
Also, in my opinion, there's a different, they call themselves therapists, but they're counselors. That is the wrong thing right there. Therapy is different. I've been in therapy for 9 years. There's a difference between a real therapist and what people think is therapy.
I agree. No, I agree. But they'll say whatever they want.
Right. It's all about this.
It is. And I have heard that like the group therapies, which are all AA based, they'll charge for them. They'll find a way to bill insurance for them. And it's just ridiculous because I feel like, 30-day programs, right? It's a joke more or less. What you're just getting sober. All right. That's kind of it. You're getting off of drugs. But if you're going to do a 30-day program, you want to make it beneficial, you need to have like individualized true therapy.
I agree.
3 to 4 days a week. Like you need it, that's what needs to be happening during that time. And it's not cheap, right? Because you're going to have many therapists to be able to provide it. And then like I've heard horror stories of one-on-one session being 15 minutes. I mean, come on.
No, it should be an hour. It should be an hour.
And so it's there is really good therapy that is out there, but a lot of these places are not utilizing it. And it's very gross and unfortunate. I think that I just think that there just needs to be more oversight. I think how this is going to work, I don't know. Ethical, we need ethical treatment. I think that places who take patients who struggle with opioid use disorder, I think that they should not be allowed to get reimbursement from insurance unless they offer MAT.
I agree.
Standard, not just Vivitrol. And this isn't anything against Vivitrol, but give people the option to try Suboxone or methadone. Give them the option to, utilize those. That not just non-addictive.
What are your thoughts on someone just getting the Sublocade shot? Because my doctor, I wasn't really in agreement with that, to be honest with you at first, but my doctor shifted my mindset on that. He's like, listen, if it works for someone and they struggle to take their medication correctly, that could be the answer. And that literally shifted my mindset. I've seen people successful with that.
Yep. No, I actually really support that. I think Sublocade would be great for my daughter because my daughter has always struggled with taking her medicine.
Did you start off by giving her medication certain times of the day, like being in control of it?
Because she asked me to. I
love that.
Yeah, and she asked me to, and of course she's feeling like crap, and so she's not going to have really a sense of time, or her mind isn't clear yet, and so I still give her medication, and
that accountability helped me. For years had to go to my Sublocade provider with the empty wrappers versus the open wrappers, and prove to them that you call me, my meds are on point.
Yep. And so, but yeah, no, I fully support people going straight to Sublocade. It's insurance can be kind of a bitch. So we don't have a lot of providers in Florida that actually.
I was about to say, in Florida, I get the most messages about people struggling to get the Sublocade shot paid for. The amount of messages that I get is up here.
Yeah, no, it is. For one, Florida Medicaid is horrendous.
I heard that.
So a lot of people don't realize Medicaid is not the same at every state.
State to state.
Yeah, and so I know they'll cover Suboxone. That is my understanding. Florida will cover Suboxone. They will not cover Sublocade, the Medicaid portion.
I have literally called Indivor and had a long conversation with them about why is it difficult for people in Florida. You guys need to look into this more. People are struggling, and this shot saves lives.
Yeah, no, and I really think, Sublocade and Brixadi is essentially the same thing, just lower, different dose options.
Right.
I think honestly those will be the future of it. The issue is, as with anything, there's no generics available, and Medicaid isn't going to cover until there's a generic available.
We need to try to make a difference with that. Like, I would love to continue to argue with them about that, or go to insurance companies, because everyone deserves whatever route of MAT that they personally choose. It's their body, my choice, right?
I think the Sublocade shot, it's like $1,500 a month or more than that.
It's like $1,800 a month.
It's
Yeah.
like-
Yeah.
1,800 every time.
I can't afford that. I mean,
Now, I do have a link for 18 different states in my link tree that does work to help somebody with Sublocade assistance.
good.
It's a clinical medication trial.
Oh, cool.
A lot of people don't think to go that route. There are clinical medication trials for Brixadi, Sublocade, any MAT med.
Yeah, no, I didn't even think about that, because clinical trials, that's how we collect our data on how successful.
I have a link. So it's in my link tree that does work. I have a friend on here that did that. He got compensated, believe it or not. And he got wraparound services for therapy, physicians, anything that he needed along his journey was taken care of.
That's awesome.
Yeah.
Yeah, I think the downside though is, are they doing it with the placebo? Unfortunately, are you going to get a placebo? That would be.
Now, this is the thing. Him and I are both 11 months medicated assisted treatment free.
Oh, wow. Awesome.
So for him, he didn't get the placebo. He got Brixadi, and that's what worked for him.
Yeah. Yeah. The issue is, when you join them, you don't know if you're getting the placebo or the actual medication. And that's kind of the downside, but it depends on where they are in the study. Also, some don't do the placebo, not in every study. So
How were things with the depression with Brooke ever since things have kind of stabilized? What's been done to make that a little easier situation to deal with since the postpartum and everything's done?
So she other times have gotten back on psych medication, each time she had been on it. But like I said, she has always struggled to take her medication.
Do you give her all of her medications? I think that's helpful for a lot of people.
I do, but if she in the past, I think it was more of, I wasn't really giving her the option to, did she want me to do it versus.
Right. Yeah.
And
the choice. You didn't give her the choice. Yeah.
But she doesn't like the side effects from a lot of the meds, like many
I'm
people.
the same way. I've had a lot of very negative experiences with psych meds. So I kind of have issues really taking it. I'm to the point where I'll get stuff prescribed. I pick it up from the pharmacy, but I leave the bottles.
Yeah, that's why I have meds. I still have meds.
I'm horrible with that.
Yeah. And so for her, but something I think people don't realize is that it really is trying different combos of medications to find what works for you. Just because somebody puts you on something doesn't mean you have to stay on that. You just got to talk to your provider about how you're feeling and your symptoms. There's tons of different meds out there, and everyone's, DNA and how you respond to meds is different. And
have you ever thought about getting one of those genetic tests to see exactly what medication would work for her?
I didn't even really know about that. I've had a lot of people comment about that. So it is something I have thought about, even for myself. I'm kind of curious.
Me too. My psychiatrist keeps telling me, Marie, it would be worth it if you would just invest a few $100 on yourself to get that test, because I do struggle to take the meds. And if I knew something was going to work for me, I'm going to take it.
Yep, no. And so I think that's something that I think down the road, I've talked to her openly. Right now, I'm supporting her not taking any SSRIs or other meds other than her Subutex. So she's using supplements. I'm not going to say what she's taking right now, just because I know people run and go want to buy this stuff. And I'm kind of just seeing if it's benefiting.
So what do you want to do with all that? You guys are in a stable place, at least right now. What do you want to accomplish with where you have gotten with your platform? Because you're getting pretty big now, and I know you've already made some moves, kind of trying to adjust things. But is there any big goal that you want to complete?
Yes, there are a few goals. It's very hard because like right now, she showed up. It kind of, I think I have a plan in place and a timeline for things, and now she's here. And so my focus is getting her right now. She's going to start therapy this week. So it's kind of my
I love that.
focus has been turned to her, and then the rest of the family, obviously. My plan for this year, my goal is to start a nonprofit. That's something that I've wanted to do. And there's many pieces of this. And the first part, something I've wanted to do is create something to help provide for children who are being raised by other family members or impacted by addiction, helping pay for their fees for uniform,
Daycare.
sports fees, like extracurricular activities that are
That's good.
so many people can't do because we don't want them to go down the same path, hopefully, right? And having a good outlet, even if it's helping pay for therapies or things like that, music lessons, dance classes, art, helping buy the supplies and pay for fees like that.
Now, how do you start something like that? Do you need to invest a lot of money?
No, you raise all your money. When you do a nonprofit, you raise it. And so it's a process as far as getting it going. And so that's like one of the first things. And I'm wanting to do something ideally with like MAT as far as developing some type of clinic of some sort that would be under nonprofit status that would provide therapies. Because really what I want to see happen when we talk about where are we lacking in treatment is I think we need to be incorporating family in treatment. I really think, I know that there are some really toxic family members who will never maybe change their attitude, or maybe they were, and so that obviously that might be different or a different approach with that. And maybe it's better to have those people completely out of your life,
Right.
But
I've had that experience. Like when I was in treatment before, they wanted to bring my siblings and my parents into the room. And my dad was like, therapy doesn't work. I'm not sitting in the room. Like, she's got a problem. And it was with a psychiatrist, I think. He literally yelled at my father and was like, this is why she is the way she is. Look at the family dynamic. And my father got so enraged over that, like literally.
yeah, and that's the thing is you can't, and
You can't force it.
yeah, my daughter and I healed because I owned my shit. Yeah.
I literally saw that 360 with you, and it's a beautiful thing, Brandi. It really is.
Yeah, and it's nobody's perfect, and that's the thing. What people see on social media, on Facebook, everybody has fucked up families. I mean,
Yeah.
it's nobody's perfect, and so I think you have to own the role that you may have played in their struggle. That doesn't mean you're responsible, but I don't.
Did you ever go through a period where you did feel responsible?
Oh,
In the beginning, when she first started doing things, did you ever say it? Oh, it's probably because like I got a divorce years ago, or
I still feel like that, and she'll tell me no, and I'm like no.
Yeah.
I played a significant role and how things played out, and it's and that is just kind of what it is you got to own your role. And that's hard. That's hard to look at yourself. And I've talked about this as far as like, I've had people be like, well, I never caused any trauma. Maybe you didn't, maybe you really didn't. But, each of us, we have things that hurt us. So something that say hurts me, if I go to my mom and I tell her that really hurt me and she blows it off and it was like, oh, it's not that big of a deal, I'm hurting from it. It's not your job to tell me that doesn't hurt because it hurts me. Everyone's pain is different. And just acknowledging. I think just acknowledging and saying, I'm sorry if I didn't give you the support you needed. It goes a long way. People just want to be heard, and I just think that's important.
And like Ivan's commenting right now, his family, when he was homeless, still loved him and still stayed connected. I've had the opposite experience. And when I was really out there and had nothing, that was just like the loneliest feeling in the world. I don't ever want anyone to feel that feeling.
And I will say it, I can't tell you guys, it breaks my heart, the comments and private messages I get from people who have years of sobriety and their families have nothing to do with them. To me, those are the worst. It literally, I'm like, none of us are perfect. Like,
Yeah. You know what it is? A lot of times the families don't accept that change. Like my family doesn't even know half the things I do. They don't even know about my sublocade journey, nothing. Nothing. And that's sad because when I grow like when my kids grow up, I don't want them to feel like they don't have that sense of family.
My mom tried to steal my car while I was in treatment, so.
Whoa, we never talked about that, Kyle. I need that story.
Oh, it was just she decided since I was in treatment, my car was in my grandma's name because I needed a cosigner. And while I was in treatment, she decided the car was going to be hers. So she went, got it transferred out of my grandma's name, put it in hers, and just took it. And I couldn't do anything. And so I was like, I was going out of treatment without a job, without a car. I think when that happened, me and my wife weren't like back together yet. So yeah, it was a whole thing. It sucks.
yeah, it's just, it's sad. It's unfortunate because I, it's hard because as a parent, I don't get it. Like, it's you love your kids. These are your kids. Even when they're grown, they're your kids. And it's it's hard. I've been angry. I mean, naturally I don't wish this life on anyone. I genuinely don't. But, Brooke and I have talked a lot about it, and in a lot of ways, both of us have said we needed to go on this journey for some reason. I think it was to heal. I believe that I'm a better person, and she thinks she's a better person because of it.
How did you like? Did Brooke ever resent at any point? I know that you were very like you asked her like if you could talk about certain things, right? Was there ever an issue between you because of your social media?
I think early on she didn't quite understand it. I mean, but I didn't understand it. Do you know what I mean? Like
It was therapeutic for you. A lot of people don't get that. Like even my
yeah,
family don't understand about the TikTok. But the thing
no.
is it's my therapeutic outlet. This is my people that I come to and I love.
Yes, it is very therapeutic. But you do have to have thick skin. I'm sure you know to do this, because you get majority is good, but you do get really bad and it will weigh on your mental health. And And so she had a hard time kind of in the beginning, but she also started seeing how I was learning and started seeing like little shifts in me. And I used to tell her, I'm like, let me know and I will stop. Like, I don't ever want you to feel like I'm violating anything. Well, I never thought that I would get to 315,000.
Right. You never thought, you're just talking into a phone, just
Literally.
thinking no one's there. Yeah, that's how it starts.
Yeah. No, and I mean, and it's funny, people assume things, and it just annoys the shit out of me. Is like, oh, do you spend any time with your family? Yeah, I do. I don't put effort in my videos, you guys. Literally, right. I can make a video in under 10 minutes. Like that's most of the time it's under 5.
Has a comment ever affected your mental health to where like you needed to get off and take a break?
Yeah, like it bothers me less now because of, I think, Brooke being more involved in the page, and she's requested to have more of a role, whereas before she was okay with me sharing stuff and I would run things past her. But was the exploiting comments. Those were always
right. That's what I was trying to get to.
Yeah.
Now I see you guys doing collateral damage together, and that's a beautiful thing. Don't you feel so blessed to be able to do that with your daughter today?
I do, I kind of go with it and I let she'll tell me if she wants to do something or talk about something. And she'll be like, why don't we make a podcast episode? And, right now it's just kind of, there isn't really any organization to it because mentally she can't handle any type of organization. So, it's just been for her to kind of answer questions that people ask. But no, it is nice. And it's, I think, been a very good outlet for her, kind of like how TikTok is as far as getting these feelings off your chest.
Therapeutic.
Yes, that provides, because it's not live. There's no pressure. That's why I tell her, I'm like, you can say, I can edit stuff out. Like, you can listen to it. And that's why we don't do really the video. I have recorded clips of us doing it, but there's no rush to do that because I don't want her to feel the pressure. I want it to be a therapeutic experience for her, which I think it has been. But yeah, it's cool.
Have you learned things, especially like doing the podcast and everything? Are there things that you didn't know that have kind of just been thrown out there and it's been a surprise, or has she pretty much told you everything?
No, I don't think there's anything she has said that has surprised me.
Right.
I think I knew all that. I don't ever pressure her to answer questions like as far as that I've asked. There are things that I learned, which I haven't actually made a video on. I need to make a video talking about it. I just forgot. When I asked her to leave in March last year, and I had talked about I thought maybe she had relapsed, but I wasn't completely sure. I do now know that she had relapsed, and she had in fact brought drugs into my home, and I was pissed. I was very pissed, and because that was something that was a huge boundary, that was crossed, and of course. She had just come home. I recently found this out. She had just come home, and I'm like, I got to tell my husband. We have to talk about this because is this a deal breaker? That was a concern, because we were raising our son. We have other kids in the house, and so we just take it day by day, and I truly, now I used to struggle with that. I'd look into the future and I'd get so much anxiety from it, thinking about
That's what I always say. Don't worry about the future because it does cause anxiety. That's what causes anxiety right there.
It does. No, I just live in the now. I really do.
Are you concerned with nitazines and everything coming out and becoming more prominent? If she went back to the street, what would happen? And are you holding on a little tighter because of that?
So the nitazines, I need to read more about everything. I had just started seeing some videos talking about this. And so I don't know enough. Obviously, I know it's not good, and there's fear with any of that. My thing is that there's always going to be something new.
Right. There's always going to be something new. Dr. Alfrey has a good playlist on nitazines.
I think you tagged me in that, Maria, while, and because I had started kind of watching little bits, but I need to watch some more about that.
Yeah, because they're definitely infiltrated the supply.
Oh yeah. Yeah, I did a video on nitazines a couple weeks ago. It's somewhere in my recent feed.
Yeah, so I will have to educate myself a little more about that. I know, is that, because that's not a fentanyl analog. I don't think. And because I know when I pulled up the medical examiner's report for 2022 in Florida, the fentanyl analogs had increased in that year by 35%. And so you were seeing the actual fentanyl was going down, the percentage of people dying from it, but fentanyl analog deaths had increased by 35%. So the carfentanil and all those, so.
The hard thing with nitazines is there are so many different offshoots of it, and you can make it so many different ways that it's not guaranteed Narcan's going to take care of it. It's not guaranteed that it's just going to be a breathing issue if they end up ODing. So it's very, very scary.
One of the things I don't get about that, it's just weird to me, is why would drug dealers want that in the supply? It makes you conspiracy theorists. It's not going to respond to Narcan? You're going to be losing the people you're making your money off of. So it's just kind of odd to me.
So is Brooke allergic to Narcan?
That's right now what we're going with, because
So what would happen? I'm very curious, like as a medical professional, if somebody's allergic to Narcan, what do you do to save their life?
so her situation, hers is very severe. There's different levels of
Anaphylaxis, right?
hers is truly anaphylaxis, and my daughter, I had learned, had never been Narcaned as bad.
Wow.
Yeah, and she would have probably died. Like,
So what do you do? Like, what would you do? Like, say you came across her, like, what is the protocol?
so for her, in her situation, I have to Narcan her and then immediately administer
EpiPen?
EpiPen.
That's what I thought.
So I have to order her a medical alert bracelet or necklace that says that she's allergic to Narcan.
Also, on her phone, if she has a phone, you can
I
put
put
that
it-
information in there. Remember to do that.
No, I did. That was actually one of the first things I did.
Because a lot of times people aren't going to wear the bracelet. I know if my mom got me that bracelet, I'd probably take it off. I'm being honest.
Yeah, but I also told her, like, I'm like, this should be, you're like kind of come to Jesus.
This is life and this is like life and death here.
And I said, this isn't. I'm like, you're always at risk of becoming a statistic when you use. Now, like, one, you're going to be lucky if somebody uses Narcan on you, but you think they're going to use Narcan and know how to use an EpiPen? Probably not.
Yeah.
And so I think it's really been an eye opener for her.
Does that make you more fearful? I'm sure it does.
It does. It was scary because I was there with both times that she about lost her airway, and I had to call EMS the first time. It was terrible.
Thank God that you're in the profession that you're in and you saw those red flags and recognized that she was in distress.
I told her, I said, honey, I'm like, if you don't believe in God, you might quit now because God.
Like, yo, you got the hairs on my arms.
No, I go, what are the odds that I'm going to be home and you literally start to lose your airway? Like it was, I mean, the odds of her not being Narcaned all these years being out there, she's like, I've given it. I've never been Narcaned. It's terrifying.
Thank you very much, Brandi, for coming on.
Thanks for having me.
Thank you, Brandi.